Hi, my name is Bruce, and I'm with 573 Medicine, and today we're going to be talking about the cardiac vasculature, including the coronary circulation and the great vessels. Digging into it, the great vessels are going to be all of the vessels that attach the heart to the systemic and pulmonary circuits. The right atrium is going to be receiving deoxygenated blood from the system via the superior and inferior vena cavae. That blood will then go down into the right ventricle before being pushed out into the pulmonary trunk and then the left and right pulmonary arteries, which will then send blood to the lungs to be oxygenated and then be sent back to the left atrium via the left and right pulmonary veins. Note here that the veins of the pulmonary circuit are bifid, whereas the arteries of the pulmonary circuit are singular. Blood is then pushed down into the left ventricle and then back out into the system via the ascending aorta, that then arches over your pulmonary trunk via the aortic arch and then goes down into your descending aorta to provide the rest of the body. Pericardial sinuses are anatomical landmarks that you can use to identify the locations of the great vessels. They are areas where the pericardium meets the vessels and are accessible after opening the anterior pericardial sac. The transverse sinus, which is the first one that we're going to be talking about, actually separates the superior vena cava from the ascending aorta and pulmonary trunk. This will allow you to insert your finger in between these three structures, allowing you to pull up on your ascending aorta and pulmonary trunk and push back on that superior vena cava. The oblique sinus is an inverted U where the pericardium is going to meet the pulmonary veins, and it actually allows you to insert your hand beneath and behind the heart, and your fingers will be in between the inferior pulmonary veins. Before digging into the coronary circulation, it's important to understand the aortic sinus. This is a dilation of the ascending aorta and the cusps of the aortic valve. The left and right cusp of the aortic valve have ostia for the coronary circulation. When the aortic valve closes, it's because the ventricular pressure is lower than the systemic pressure, and if it didn't close, then blood would be flowing back into that left ventricle. When it does close, blood does push back against your aortic valve, and the aortic sinus and coronary system provide a pressure vacuum, allowing for some of the blood to flow down and into the coronary circulation, providing oxygenated blood to the heart muscle. Each ostia will provide a coronary artery, so your left ostium will provide your left coronary artery, and your right ostium will provide your right coronary artery. The right coronary artery branches into several different branches, but the first one is the sinoatrial nodal branch, and it's aptly named because it provides blood to the sinoatrial node. The RCA then flows down the anterior side of the heart and creates these right marginal branches that will provide the anterior wall of the heart. The RCA then flows back around the backside of the heart and creates the posterior interventricular artery, also known as the posterior descending artery or the PDA. And this just provides the posterior wall of the heart. The left coronary artery splits into two major arteries pretty quickly. The first is going to be your circumflex artery, which will provide most of your lateral and some of your posterior portions of the cardiac wall. And then you have your LAD, or the left anterior descending artery, which is going to be providing the septal region of the heart. Deoxygenated blood is going to be leaving the heart muscle via these cardiac veins. The first two are going to be your small and middle cardiac vein, which act as drainage pipes for the tributaries of the right coronary artery, whereas the great cardiac vein is going to be draining off the blood from the left coronary artery tributaries. So your middle and right cardiac veins are going to be important for your right side and posterior side of your heart, whereas the great cardiac vein is going to be responsible for draining off the lateral and septal portions of the heart. All of these veins drain into the coronary sinus, which is going to be a dilation of the venous tissue that then flows into your right atrium. Finally, the coronary circulation provides blood to both the heart muscle and to the electrical conduction system. And the sinoatrial nodal branch of the RCA supplies the SA node, which is the master pacemaker, and sets your heart rate at about 60 to 100 beats per minute. If the SA node goes out, there are other pacemaker cells in the heart, including your AV node, which would set it at 40 to 60 beats per minute for your ventricles, And if that node is also out, then the ventricles themselves can create their own pacemaker rate at 25 to 40 beats per minute. The SA node is going to create electrical signals that will then flow down through internodal branches within the atria themselves and will converge on this atrioventricular node. Those electrical signals will then fire down the bundle of His that then separates into your left and right bundle branches. Once those bundle branches reach the apex of the heart, they make an acute turn and become the Purkinje system, which will provide the electrical impulses to the ventricular myocytes. In this video, we covered several things, including the structures of the great vessels and the coronary circulation, and we did a brief overview of the electrical conduction system of the heart. If you liked this video, please like, comment, and subscribe, and email us at any time at realtalkmeded@gmail.com for any comments, questions, or concerns. Otherwise, thanks and have a good one.